Hi, my name is Tiffany Banks, and this is for my Nursing Leadership and Management course at Morehead State University for NURB 461. I decided to talk about the controversial issue of whether or not family members should be present during a resuscitation of their loved one. As healthcare workers, um, I know probably 100% of us have either witnessed or been part of a resuscitation effort of a patient. At the current facility that I work at, our we kind of do the same routine. When we have a patient that is unresponsive or has went into a respiratory or cardiac arrest, we press the code button on the wall. The code team comes, house administrator, physician, chaplain. The family member is then escorted outside of the room, and they are taken into a conference room or a private area, and the chaplain will then go and sit with the family members and grieve with them, pray with them, and speak with them, and try to answer any questions that they may have in regards, or answer any unanswered prayers or requests, etc. During the resuscitation itself, the physician and or house administrator will then communicate back and forth with the family members about the efforts, whether or not the efforts are working, or if they have been revived and they're going to be going to the intensive care unit, and kind of what the next plan of care is. And the physician will then come out once they're revived and talk about the plan of care with the family members and kind of discuss the factors that kind of led up to the event, etc. And then if the patient is not doing well or is not responding at all to the efforts, then the physician then goes and talks to the family member as well about that, and then whether or not the need to continue resuscitation then becomes at the mercy of the family members. The process that works here has been very effective thus far. But it is a topic that is very controversial and very ethical in a lot of different matters, and it is something that has been talked about among nurses and physicians at the facility I work at, and most are opposed and some are for it. To kind of look at pros and cons from both aspects, I'm going to start off with talking about the pros from what I feel that the family members, the relatives' perspective would be to be in part of the resuscitation itself. The first thing I feel is that it would help the family members come to terms with the reality of death, maybe even avoiding prolonged denial or prolonged resuscitation, and it kind of can help them come to grips of reality in a sense. Also, they could speak directly to the patient, as some family members have said that they feel like that their family member can hear their voices in the background. Also, I feel like that the family members feel their presence is very, very important to the patient. And it's not only important to the patient, but it's important for the family member to be there as well. Kind of gives them a sense of not security, but a sense of relief, or just knowing that they're there for the family member. Also, it could provide a sense of not feeling distressed from being separated from their loved one, and in the sense that they're there with them during that particular point in time. So if they were to pass away, then they were there with them during their last moments. Also, it's a benefit for the family members and the healthcare workers in the same aspect that the family members see the efforts that the healthcare providers have been doing to try to resuscitate their family member. So they can see the efforts and the struggles, and they can see that everything that could be done was possibly done at that particular point in time. Also, in some situations, they could even touch the patient, and and if there's more than one family member present, then they can kind of help each other cope um, with their family member either A, passing away, or B, being revived and going to that next step after being revived from a resuscitation. Those are kind of some of the pros that I feel are from the patient aspect. Now, the pros for the healthcare would be in a sense that if you need just quick information that you can't get to a computer or you can't access the information right then and there, that family member could be able to answer questions for you, and the fact that that they also see that what you're doing is everything that you possibly can do. Now, the downfall to some of the conversations that I have heard and I have witnessed as far as cons go from the healthcare perspective is that there is a potential that there could be increased stress level to the staff as well as to the family members during this particular high intensity, high emotion resuscitation effort. If the family members are present at the bedside and their intensity and emotional level is really, really high and their stress levels are extremely high, then that also kind of rubs off to the staff members that are also involved as well. Also, some healthcare workers have said that they feel that the family members will try to interfere or influence a decision to stop a resuscitation, or if there's a couple of different family members in the room, that the family members may differ on opinion, etc. And if there wasn't a living will or advance directive, then all these ethical issues become involved as part of the resuscitation period. So healthcare, from a healthcare perspective, that is of concern as well, is that there will be some sort of influence or decision to either prematurely stop a resuscitation or to prolong the resuscitation itself. Also, there is the fear from the healthcare perspective that the family members will try to interfere or try to input data or information to once again prolong and or stop resuscitation earlier than needed for the patient themselves. But I think that the biggest thing that I have really heard from the cons to the healthcare perspective is the fact that it would decrease the performance of the staff in a sense to try to do their role in order to try to save the patient's life. But the biggest thing as well is the repercussions of the family members at the bedside that while the healthcare workers are resuscitating their family member, it's a very distressing, it's a very physical, and it's a very emotional aspect, and that this in general would really interfere with a family member for a long period of time in a negative aspect. However, in a more positive aspect, if once again they saw that the healthcare providers were doing everything they could, then it may not prove, then it may not be as near distressing or as physically or emotionally distressing as some in particularly that are more informed than others. If you have family members that are more informed about healthcare in general, and they know a lot of aspects about healthcare, they are probably going to be more apt to understand what exactly is going on versus the family member who is not well versed in the healthcare field at all. And it could be very traumatizing. It could be very distressing. Maybe for a short period of time, but also maybe for a long period of time as well. So there really is no right or wrong answer to this. I feel there's positives and there's negatives in both aspects. But I do feel the way that we do the resuscitation here has been very effective, and we've got very positive outcomes from that. But as medicine opens up and it becomes more evolved, I do feel like that in the future that family members will become part of the resuscitation efforts and needs of the patient. And I do feel like their voice needs to be heard as well. So with that being said, it is a controversial topic. There are pros and cons to both, and you kind of have to have an open-minded approach when you're talking about this particular concern, and you have to look at the different legal aspects as well. It just goes beyond the rights of the family members, but it's also a legal aspect as well. So just the pros and cons are something to keep in mind. And as we near the future with medicine, I do feel like that this is going to be a growing part of the care that we will be providing. And thank you very much.